in 2020, Hong Kong is more or less started the whole pandemic like anywhere else. And we have the first reported case in January in 2020. And we have a short honeymoon in 2021 because Hong Kong was relatively unscathed by the first wave until 2022. And because of the high initial honeymoon is basically because of the high degree of the wearing the mask in public, because of the painful lessons that we learned from the SARS epidemic 15 years ago, and that actually makes Hong Kong a kind of the high position in the wearing the mask, and then we don't need the mask mandate because actually most of the people in the streets say if we don't wear a mask, somebody will report you.
So what we would like to know is, like, what is the factor that to make the dermatologist, dermatologic surgeon, or any other subspecialty decided to perform like treatment on the patients? And, since we all know that pandemic, it's, across the world, and it impact a lot of practice, like what Casey has been present earlier. And what we know is usually it transmits from people to people, and there is a lot of report conducted, report that the doctor performing procedure can also get COVID from the patients. And for us, like, mainly, especially aesthetic procedure or dermatologic surgery procedure, we do procedure mainly on the face. And sometimes the patient need to take the mask off. So, it would be very easy to contact and, get spreading of the germ. So we had a lot of measures to prevent, for examples, like, we are doing swab before, we are using extra care, wearing PPE during the procedures to prevent transmission between patients to us or from us to patient.
Finally, I will introduce precautions related to specific cosmetic procedures and body sites according to risk stratification of procedures, and show guidance for healthcare personnel exposed to SARS-CoV-2 and symptomatic healthcare personnel. Let's get started from now. For SARS-CoV-2, various modes of transmission have been proposed, including aerosol, surface contamination, and the fecal-oral route, representing compounding factors in the current COVID-19 pandemic. Transmission was initially assumed to occur primarily via respiratory droplets from coughs and sneezes within a range of about 6 feet, and may be airborne as well. Indirect contact via contaminated surfaces is another possible cause of infection. Virus may remain viable on copper by 4 hours, cardboard, textile, and tree by 1 day, glass by 2 days, polypropylene and stainless steel-like operation room environment by 4 days.
It's we really haven't had any strict restrictions for seeing the patients at the outpatient clinic, but we try to limit the number of cases that needs to have the face masks off, especially for cosmetic procedures. Well, my clinic is usually for cancer patients, so I try to postpone the early BCC cases, but I had to take care of the melanoma patients. But fortunately, the melanoma patients are usually acral type, so they really did not have to take their masks off. And I was contracted with COVID like 3 weeks ago, and same as Peter's case, 2 of my residents got infected first, and then I was contracted. So it was not from patients; it was from our own staff.
Various variants, including Delta, we expected that the vaccination can cover the proper protection against the many variants about the Omicron spread. As the Omicron spread, the coupled escape activity against the vaccination is higher than other shots. So, but as your country, similarly, the Omicron is very transferable, and the higher portion of patients are increasing. So many countries now decrease to quarantine period, initially 14 or 10 days to 5 days, and even more in terms of full vaccinated or boosted.
But
Yeah.
the vaccination, you think if there are more vaccination, it will help?
Yes, of course. So right now, most of the healthcare personnel, we got 4 already.
Oh,
Because
okay.
because we didn't count Sinovac. Like
Alright,
the first 2,
yeah.
we
Right.
didn't really count. So most of us got like 4 or 5 already.
That's
So
the
which-
last few will be mRNA.
Yeah, the last 2 or 3 is mRNA, and some of them get even booster from a viral vector. And you know, as you can see in the presentation, we don't really trust our government, and we went all crazy.
But South Korea has got the same problem, right? You have got something like a few 100,000 cases a day some time ago, recently, and it's only now that it's dropping. And what's the reason for that?